This next program is about a tragedy that's going on in America today, a tragedy that we have laws that are intended to prevent, a tragedy that's gone on since this country was founded because industry takes over the worker and poisons them with their job. But we passed laws that says you can't kill your workers. At least if you're going to, you got to tell them that they're driving a gasoline truck that could blow up or working with mercury that could poison their fertility. Yet we've got study after study showing that dentists are poisoning their staff. I've got dozens of people that have contacted me, and you're going to see some in this video, whose lives were ruined by their occupational exposure to mercury. There are laws against that. There are lots of laws against that. I've had dentists argue that they're not responsible because they don't have to comply with the laws. Well, that's ridiculous. What industry doesn't have to comply with the laws? But nevertheless, we went to the California Department of Occupational Health and Safety, the enforcement branch, and asked them, are dentists required to comply with the law? And they said, yeah. Well, here's the data. We have dental assistants that are rendered infertile. 40% of them are infertile because of their occupational exposure to mercury.
The whole part of this, after I've learned everything that I've learned now after my diagnosis, is that all the continuing education courses that we ever attended, and we attended them monthly, they were always about infection control products, or a clinical course on restorative materials, or administrative classes, you know, those types of courses, motivational courses. But where was the ones on the mercury? They were non-existent. In the clinical courses, when I think back of going to those, of course, they all had their PowerPoint presentations, and they would show befores and afters of restorations of teeth with the black, silver, mercury fillings in there, and how they would be removed, and they would put the tooth colored in and then restore them, prep them for crowns or bridge or whatever. But there was never no talk of mercury with any of those silver fillings. And so when I think back on it now, it's just, I'm just on some level just really outraged because I've been deceived. There's no doubt in my mind that we were not giving the whole story, and that's on purpose. And so the MSDS sheets, of course, you know, list acute and chronic exposures on there, and the use of masks and protective personal equipment. But I have no recollection of anything being on there cited with the mercury vapor mask. It was always a mask, and so I thought I was purchasing the best one for our team, and that we had the 3M triple layer mask. And so I thought, you know, the more protection, the better. But again, I was thinking particulate matter, dust particles, those kinds of things, not thinking about the vapor. Didn't know about the vapor. Somehow I missed the whole story on the vapor. The clear, odorless vapor that you can't know that you're being exposed to. You can't smell it, it's odorless. And so, like I said, I think that that needs to change, you know, for the other 266,000 dental assistants in this country who are possibly on the same page as I was in terms of not knowing about mercury and the vapor. I knew there was mercury in the silver fillings. Occasionally we would have a patient that would ask about it, and we would just say that's not an issue, it's not a problem. When it hardens, it's bound, and it doesn't leak, and if it does, it's very minute, and it's not a problem. We had the ADA brochure on mercury that we could then hand to the patient, which would then say basically all that it's bound, it's not harmful, it's only a problem if you're allergic. And so basically all I heard for 27 years is, it's fine, it's fine, it's fine, unless you're allergic. I'm here to tell you it's not fine. And so it's poisoned, and I've been poisoned. I believe that I've suffered the worst kind of damage that the ADA and FDA don't want to hear about in terms of neurological damage from head to toe. And so toxic neuropathy, chronic fatigue, just a host of symptoms, with all systems of the body. I believe it's everywhere. Well, I was told that I have total body burden in excess of 1,275% toxicity in mercury, and 1,000% toxicity in lead.
Recently completed experiments by scientists at the University of Calgary's Faculty of Medicine now reveal, with direct visual evidence from brain neuron tissue cultures, how mercury ions actually alter the cell membrane structure of developing neurons. In this experiment, neurons also isolated from snail brain tissue were grown in culture for several days, after which very low concentrations of mercury were added to the culture medium for 20 minutes. Over the next 30 minutes, the neurite membrane underwent rapid degeneration, leaving behind the denuded neurofibrils seen here. In contrast, other heavy metals added at this same concentration, such as aluminum, lead, cadmium, and manganese, did not produce this effect.
I was told that the mercury that I was exposed to pulled the lead. And so if you're going to have one metal, you're likely to have two metals because they play off one another and pull one another. And so I didn't work in a paint factory. I wasn't exposed to lead and then got pulled with mercury. I handled mercury, and so every day for decades. In terms of OSHA and testing for mercury with vapor analyzers and employees being tested for vapors and on an annual basis, biannually, whatever, I have no recollection of having seen that in print, that was to happen. I've seen it since. It was interesting after my diagnosis that I tried to acquire those types of tests to measure the mercury. And my supplier told me at that time that, no one's asked me for one of those, have any of them. So I couldn't test the quality of the air in that laboratory before I left. And so it was my doctor who first made me aware of the International Academy of Oral Medicine and Toxicology, and it was one of the first phone calls I placed after my diagnosis. Thanks to him, he gave me the address and phone number of this organization in Florida, and I called them and I ordered the tapes on safe removal of mercury amalgam for my boss and the associate dentist, and would hope that they would make the change. But there was resistance, obviously, and denial, and so to this day, I don't know if they ever viewed the tapes or not, but as far as I know, they're still placing mercury amalgam. It's interesting that, all those years I thought I was protected from any harm from mercury, knew there was mercury, I was handling mercury. It was a combination of the mixture of the alloys and the liquid mercury in the capsules that, of course, would get triturated in the amalgamator. And I would have to recover that, which was amounting to the pulling apart of the capsule and having the amalgamated material, which then would get dumped into a well, which then the double-ended carrier would be loaded on both ends. And so what I learned since not working is that every time that I did that, when I recovered the capsule, that putty sort of material substance into that well, that every time I did that, not only was I exposed when I opened the capsule from the vapor that was in the capsule, and plus any that was leaking out as it was shaking, but that one action of just trying to get that to be in that amalgam well, to be loaded, that the vapor from that was 1,000 parts per million or whatever. Then it's handed off to the dentist, who then expresses that into the cavity of the tooth. He'll get a burst of that as well, be passed back to me, and I would redo that again. And so then there's always the issue of drilling out old amalgam fillings as well, where then you are again exposed to mercury vapor as well.
What you're hearing is dental personnel who are injured by their occupational exposure to mercury. The entire dental profession is in denial. The schools teach the dentist that they're using a safe kind of mercury, and they don't teach them to comply with the laws of this nation. So they lie to their employees, they lie to their patients, they lie to everybody about the dangerousness of elemental mercury. And that's the problem. You can see here that Karen Palmer has been injured by her occupational exposure. Why? Is they didn't follow any of the laws that are required. They didn't protect her, they didn't give her the right mask, they didn't give her informed consent, they didn't measure and monitor the facility. All of this is standard law in all industries throughout the United States, and the dental profession is in complete denial that these laws even apply to them. Well, the result is employees end up infertile. They can't raise children, or if they do have children, the children are often impaired. Employees are impaired. There are even studies showing dentists are impaired by their exposure to mercury. And what are we doing about it? Not one thing. 76% of the population did not even know that there is mercury in a silver filling. That is a deception. A lot of people don't realize that these fillings are mercury. See those black fillings in this model? Those are not silver. Those are 50% mercury, 35% silver. It's a deception of the consumer to call them silver.
I was a dental assistant that stayed in the room with the dentist and practiced four-handed dentistry, so I never saw the container with the warning and the skull and the crossbones. I just saw the capsules and all the supplies were in the room. But I sat there and I mixed it, opened the capsule, as Karen said, and breathed it in and passed it on to the doctor and under the patient's nose, and I don't feel really good about that. I have chronic fatigue, fibromyalgia, lower immune system. I'm sick a lot. A couple of days a week, I can't get out of bed.
What did the occupational health and safety people say when you told them that you thought you'd been injured on the job?
Well, I went to workers' compensation in New York, and they told me that they didn't think my mercury poisoning caused my sickness, so they wouldn't pay for me to get the mercury out. And as far, I didn't go to OSHA. In the state of New Jersey, I worked both in New Jersey and New York, and I went to Trenton in New Jersey to try to get them to practice safer. I have dental offices tested and become more safer, and we're still waiting for a bill to be reviewed by the Health and Senior Services. It's been 3 years. They haven't looked at it yet.
Both of you two ladies spoke before the Food and Drug Administration hearing on dental amalgam.
Yeah.
Did they call you up and apologize for not protecting you, or say they were going to get right on it? Or?
No, I think they said that even though they voted that the scientific papers were inconclusive and they had to look further into it, and now I think a miracle has happened because they forgot about all that. I haven't heard anything. That was 2006. Did they ever review that hearing?
Yeah, they did. They said it was perfectly safe.
Yeah, well, I don't feel perfectly safe.
Since the 2006 hearings for the FDA, I've been involved in the Pennsylvania Coalition for Mercury-Free Dentistry and legislation in that city, in which they achieved the first city to have informed consent, mandatory informed consent, that dentists must tell the patients that the silver fillings are 50% mercury. And so that papers have to be signed in accordance to that, to attest that that's being done. And so it came to a fact sheet was formed, and also there was a state bill that was introduced as well, and so I was involved with that. That since has gone somewhat to the wayside now, since the latest FDA final rule came out in July of 2009, as they pretty much removed some of the warnings that they had previously had on their site from the year before in 2008.
Could you talk to me more in depth about what happened in 2009?
2009, the end of July, the FDA issued a final ruling on the classification of amalgam in a class 2, which basically says it's still safe and still allowed to be used with some minimal warnings. But certainly I was not happy in terms of the occupational warnings, still not near enough, and they're buried on their website. I mean, they're not easily accessible. If you go to that website and want to know, what they say in terms of this for occupational exposure, you'd be hard pressed to find. And then it's like minimal. And so I don't think that it's protecting anybody.
I've been pretty sick lately. I think that that's what the FDA and the AZA wants, for all of us to just get sick and fade away so that they won't have to face all of this. So I haven't been doing much, but when I can come and support these people that are working on it, that's the little bit that I can do.
There are laws against what they did to you. They're not, you don't need new laws. The laws we have already, we've determined all of those laws protect you, but they're not enforced. And if they're not enforced, they don't protect anybody. It's like a speed limit with no cops.
I asked in workers' compensation court, I said, how can I have mercury poisoning working with mercury, and why am I not protected on my job? At the very least, I thought they would at least help me take the mercury out. It cost me thousands of dollars, and this has been years, and I'm still sick. So how am I protected?
What did they say?
Nothing. They said you can appeal it. And I did, and they said no. That was it. That was it. So I don't feel protected in the United States of America.
Why do you think they're so resistant to admitting that all the good people that help in dentistry are at risk?
My personal feeling is because so many people are getting sick in dental offices in different ways. I've met people with cancer, lupus, fibromyalgia, neuropathy like Karen. It comes in so many different ways to people that if they ever associated with their jobs, that there would be a lot of lawsuits. And that's what I think, why they won't open that can of worms.
I think you're right. It doesn't explain why they're not willing to measure the office, which is a requirement of the law. You can't just do it. You have to measure the office. Any thoughts on why they won't measure the office? At all, ever?
They don't want to. Why would they, they test it for they test the x-ray machines to make sure they're not giving off radiation. If they wanted safety in dental offices, I mean, you can't go into the factory where they make the amalgam and say they're not checking for safety there. Those people are given suits to wear to handle that we have, not even the proper masks to handle the same product.
Do you know any other dental assistants that have been injured on the job?
In one office that I worked in, one girl had lupus. One of the doctors just told me that he came down with prostate cancer. 2 women died of breast cancer. I have fibromyalgia and chronic fatigue, and 2 babies were born with defects in one office. And it was an old office where, in the 50s and 60s, we used to have bottles of mercury and silver pellets, and mercury got everywhere. So I would imagine it's deep in that building. You have any sicknesses on your job?
No, we had miscarriages and full-term births that were, resulted in babies being born, stillborn. A lot of thyroid disease and cancer and fibromyalgia, depression, suicide. Too many. But years ago, they looked at nitrous oxide as being the culprit to a lot of problems, and so at one point they instituted scavenger lines be installed to capture any additional or excess nitrous oxide, thinking that was the culprit. But then when these medical problems still pervaded, then obviously then that was not the problem, but I was never linking it to the mercury. I firmly believe that when you're handling mercury and you're working around it, you can't make good decisions about how not to handle mercury. You're just in that realm and you have to be away from it, step away from it, not be around it, and clear the fog and then be able to think clearly about what you were doing and how you were doing it and what a mistake that it was.
Yeah, and it's hard to find once you start getting sick, and it's really hard to find this information to protect yourself. I worked for 4 years after my doctor told me not to work anymore. I didn't want to leave my job, and I thought as long as I wasn't in the room handling the amalgam that I would be safe. I never thought that it would be throughout the office and come from people's mouths when we were taking out the fillings. I didn't know.
What you're seeing on the screen is a bowl, and into this bowl we're going to pour a little bit of mercury. And under normal lighting conditions, you can't see anything. It just looks like it's a beautiful liquid shiny metal. That's why they call it quicksilver. It looks like silver, but it's not. It's a liquid mercury. And so now we're going to change the light to one that is made of mercury vapor. And so now you can see under the new lighting conditions and the reflective screen, you can see mercury vapor coming off of this little bowl of mercury. Well, if we applied this same technology to dental fillings and did anything to the filling like chewed on it or brushed it with a toothbrush or rubbed it with a pencil eraser, more mercury comes off. And that's in your mouth every day, every time you chew. It's in the dental assistant's face every time she mixes an amalgam. Karen says she was buying the best mask and she got the cloth mask that they use in dental offices. You've seen them, the blue ones. This is the Mine Safety Association mask that is required if employees are going to be exposed to toxic elements. See the little button on the end? It's two colors. If you're exposed to mercury, it turns brown and you remove yourself from the area and get a new mask or change the canister. It fits with two straps over your face, so you sound like this, and it restricts the air so it has to go through a filter that filters out mercury. All industry is required to furnish employees masks of the equivalent of this or better if they're going to use any mercury. Dentistry doesn't do that. They just expose employees to mercury, poison them, and then deny that they've injured the employee. It's time for that to stop. Here's an amalgamator. That nice sound, you've heard it 1,000 times when you were having a tooth filled. Well, that's when they take liquid mercury and mix it with silver. And then it mixes it up, it heats it up too. And so that makes mercury spew from the capsule every time it opens. These ladies are handling this stuff with their fingers, right in front of their noses. And then they pass it right in front of your nose and then stick it in your tooth. This is a crime. These levels, if you can see it on the screen, the level is above the level that OSHA would require you to flee if you were an employee wearing masks. And people are doing this with their bare face. It is not a wonder these people are being poisoned. You've heard from two people, but there are literally thousands of women in dentistry and men who have been injured by their occupational exposure to mercury. And the reason is very simple. The dental schools lie to the dentist lies to the patient and their staff, and the occupational health and safety people are too busy to bother to enforce the laws that we've passed that are supposed to protect us. Well, it's time for all that to stop. And I suggest that you pick up the telephone and call anybody you know that's a dental assistant or a dentist and tell them, say, do you know what the laws are regarding occupational exposure to mercury? And then you fill them in, because they don't know. And that's not talking about the dental schools, is it? A dental school is not an employee, but the student has to be protected at a much higher standard called Environmental Protection Agency. There was a mercury spill over in Calexico in California and another one in Kansas City. And what did they do? They evacuated the school and closed off the room when the levels were not visible under these lighting conditions. You couldn't even see the level of mercury that those schools were exposed to, but they evacuated the students because the EPA doesn't allow any more than 0.3 parts per million. You can't see that with this kind of light condition. So what are we talking about? We're talking about schools that violate the law. They expose the students to levels of mercury that are known to poison. They expose the students without protection. They expose the students without knowledge, and they expose them without monitoring. All of these things are regulated. All of these injuries would stop if they followed the law. What does the law require? It requires the employer to give the employee informed consent if they're going to be exposed to any toxic element, including mercury. They have to give the employee protective equipment. They have to provide a work-safe environment that's carefully monitored and monitor the employee as well for symptoms of poisoning. They have to protect them by providing instruments and equipment that suck the mercury away. And they also have to use what are called work practices that prevent the mercury from being released. And when that's all said and done, they have to keep records of that for the next 30 years, available for inspection 24/7. They're not doing that. They're breaking the law. And there's severe penalties for breaking this law if we could just get the people that are supposed to do it to enforce it. Exactly the same thing was going on in other countries, like Norway, for example, where their occupational health and safety people said, oh, it's so little, it's so tiny amount, it couldn't possibly be causing all these injuries in dental personnel. And you know what? When the TV station ran the special on all the injured employees, they investigated and they found that the levels are not small, they're huge. And now those employees are covered under workman's compensation. Thank you very much, but they can't have healthy children, and that's the problem. If you told the truth, this material would disappear in a blink, because nobody would say, yes, I'd like a mercury filling. Call them what they really are. They're not silver, they're mercury. Stop the lies.